My name is Janet Timmerman. I was a museum director for many years, but now I'm an independent scholar. That's a fancy way of saying I'm retired. So this pandemic took almost 2 years of my normal life away. I lost loved ones, and I couldn't even gather for a funeral for them to say goodbye. I canceled trips, holiday parties, and I worked from home. I'm an extrovert. Working from home was hard. I couldn't hug my grandson for over a year. The vaccine gave me a chance to get my life back. I have trusted vaccines and the people who create them for most of my life. My parents made sure that I had all of my baby shots. My mom kept the official record of all of them required by the school. As an elementary student in the 1960s, I was part of the World Health Organization's push to eradicate smallpox. I remember getting that smallpox vaccination. It was a multiple needle poked under the skin, and it left a blister, and then it left a scab, and then it left a scar on my left arm, and I still carry that. The only good thing about getting that shot was that we also got a sugar cube with the polio vaccine on it afterwards, so a spoonful of sugar helped the medicine go down, I guess. When my own children were born, I never hesitated to get their measles, mumps, and rubella shots and kept them up all of their vaccinations all through school. Maybe it was important because my family heritage involved a really tragic event. My great-grandmother lost all 3 of her children, age 9, 7, and 3, to a communicable disease within a month of each other in the 1800s. My grandmother was the first child of the second family. She was born just a year after that. So as a historian, I'm called to teach local history, both the good and the bad. Part of this is medical history, and when COVID hit, we looked back at other pandemics for clues as to how they were dealt with in the past. And in one such dreaded disease that was especially frightening to families in the region was poliomyelitis. In the years before I was born, polio was a dreaded disease for children, but also for adults. It caused paralysis and could cause death. One day a child was fine, and the next day they couldn't get out of bed. Children throughout the county were contracting the disease, and just like COVID, gathering in large groups was limited, and they even shut down the Murray County Fair one summer because of polio. This leg brace was used to help children who might have lost the use of their leg. They could walk with these. If the muscles weren't used, if they had polio, they would waste away and they would become crippled. They wouldn't be able to use those legs. So they tried to get children to use them by putting braces on their legs. Others walked with the help of crutches. Some people needed help breathing and had to be put in a machine called an iron lung. In 1955, doctors developed the Salk vaccine, and that could be given in 3 doses. And just like COVID, people were a little afraid of the vaccine. They refused to take it, but slowly they realized how effective it was. And within a few years, the polio vaccine was a regular part of childhood vaccinations. Today, there's no use for iron lungs because polio is almost eradicated now in the United States. So I got the scar, I took the sugar cubes, and I made sure my own children were vaccinated. When the COVID vaccine became available, I took it for my own safety. I took it for the safety of the people I love and those in my family who had underlying health conditions. I took it for people who can't take the vaccine because of health issues. And I took it for my community at large.